Welcome to the Virginia Provider Portal Overview e-learning training. By the end of this e-learning training, you will be able to understand basic navigation of the provider portal, identify which tasks are accessed from the provider portal but completed in other systems, manage provider information and identify where to manage and delegate information. The provider portal is a self-service tool to view and maintain provider information for the Virginia Medicaid program. Providers receive credentials to access the provider portal upon approval of the Virginia Medicaid program. Secure messages and live help tools support efficient communication with Provider Service Solutions, PRSS enrollment and management clerks. Providers can create delegates, which gives portal access to their clerical or administrative staff to support daily operations. Let's learn how to access the provider portal. To log in to the provider portal, go to the MES login page. If this is your first time logging into MES, find your two emails with your MES credentials, one with your username and one with your password. If you have multiple service locations associated with your NPI, you'll only receive one set of credentials to view all link service locations. The first time you log into MES, you will be prompted to reset your password. Additionally, if you forget your password, click the Reset Password hyperlink after entering your username and password. Click Sign In. Click on the blue arrow on the Provider Management tile. Then click on the PRSS portal. If you only have access to manage your own account, your provider portal homepage displays, and your NPI will display on the provider identifier bar. If you are a group provider who is also an authorized administrator for at least one individual with any group, you will be asked which profile you would like to manage. If you would like to access your own account, select No and click Submit. If you would like to access an account for an individual with any group that you are authorized to manage, click Yes. Next, click the provider's name in the table, and then click Submit. When you log in as an authorized administrator, the provider identifier bar indicates which provider you are logged in as. Select Go to Switch Associated Provider to select a different provider. If you are a delegate, you will be asked which provider profile you would like to manage on the Switch Provider page. Click the provider that you want to work on behalf of, and then click Submit. Click the desired service location, then click Submit. The Provider Portal homepage displays the NPI and service location of the account that you are managing in the Provider Identifier bar. Select Go to Switch Provider to select a different provider or service location. Let's learn how to access key system functionality and supporting resources from the Provider Portal secure homepage. The Provider Portal homepage has 5 main features: the at-a-glance bar, navigation menu, message center, an additional menu with module tabs, and helpful links. The at-a-glance bar displays throughout the provider portal and provides overall system support. On the right of the bar is the search feature. Use search to search for key terms directly from the provider portal. The messages feature lets you view broadcast messages related to system outages, system upgrades, new system features, important information messages, and various other reasons. Any messages that need to be acknowledged are considered highest priority and thus display at the top of current messages. Select the red checkbox to acknowledge. Once the message has been acknowledged, it appears in the Acknowledged Messages section. The Contact Us feature lets you view how to contact various departments for provider support via email, phone, or mail. The Frequently Asked Questions or FAQ feature lets you view questions and answers related to common topics about or related to the information contained within the provider portal. The Portal Help feature lets you view help topics about provider portal functionality and the kind of information available. Portal Help appears in a new window. Lastly, the Logout feature lets you securely log out of the provider portal. The navigation menu displays throughout the provider portal and provides easy access to all modules in the provider portal. Click a navigation menu link to reveal the submenus and click the option that you want. Module tabs are quick access features related to features on the navigation menu and are available on the side menu bar of the provider portal secure homepage. Click the Module tab to reveal quick access to the feature. The Message Center feature allows you to send, receive, and track secure messages to or from PRSS enrollment and management clerks. The Message Center tile displays the message count and links to view and send messages. To read a message, click the View Messages Now hyperlink on the Message Center tile. The inbox window appears. Double-click a row to view the message. To send a message, click Create New. The Create Secure Message window appears. Enter details, then click Submit. A confirmation message appears. Alternatively, you can also send a message from the provider portal homepage by clicking Send Secure Message on the Message Center tile. To view sent messages, click the View Messages Now hyperlink. The inbox window appears. Click the Sent tab to view a list of sent messages. Double-click a record to view the message. The Helpful Links section includes quick access to supporting resources, such as Live Help. Live Help is an online service that allows you to chat in real time with PRSS enrollment and management clerks. Live Help provides instant online support. To use the Live Help service, click Live Help from the Helpful Links section. The live chat window appears. Enter your contact information, and then click Submit. Let's learn about the revalidation feature. The revalidation feature enables providers to view the revalidation due date for a service location. A delegate can also view this page in the provider portal if they are assigned by the revalidation security function for the service location or locations. To begin revalidation, click the Maintenance module, then select Revalidation. The revalidation page appears. If you have more than one service location, click the Service Location field for a drop-down list and select a specific service location. The revalidation information appears at the bottom of the page. Revalidation is available 90 days prior to your due date. A hyperlink is displayed in the Revalidation Information section when it is time to complete the application. Click the hyperlink for the Provider Enrollment Resume Revalidate page. Please refer to the Virginia Provider Enrollment Revalidation Overview video to see the revalidation steps. Let's learn how to manage your provider information. The provider portal has been established to provide a convenient process for updating and submitting changes to your organizational information. To access and manage your organizational information, click Maintenance, then select Manage My Information. The Welcome window appears. If you have more than one service location option, select your desired service location from the drop-down list. To proceed, click Start. Let's learn about the General Information module. The General Information page appears. There are two bars at the top of the page. The Provider Identifier bar indicates the provider's name and the National Provider Identifier, or NPI, for the information in this module. Below the dark-colored bar is the Navigation bar. The Navigation bar shows you which module you are currently on, which is indicated by a highlighted tile. The Navigation bar also provides a list of all the modules you can access to view or update information. The tiles displayed are based on the provider's enrollment type and other enrollment details. At any time, you can navigate to any tile without having to complete them in order. The General Information module contains information about your provider's initial enrollment, identifying information, degrees, and electronic funds transfer, or EFT status. In this module, like any of the others on the navigation bar, you can view, add, or update information. Let's look at the sections in the General Information section. The first section listed is Enrollment Information. This section contains information about your initial enrollment. This information is view only and cannot be edited. Below enrollment information is the Provider Information section. This section contains your identifying information. If you want to update information in a section, interact with a specific field you want to edit. Text fields can be edited by clicking on the field and then proceeding to delete or enter text. Drop-down fields allow you to click the drop-down box and select your desired option. Radio button fields allow you to select your desired option. After you have completed making updates to a section, click Save to successfully update the information. The following section is degrees, which contains your personal scholarly degrees. If there are no records listed in a section, but you wish to add records, you can do so by clicking Create New. A window appears where you can enter information. When finished, click Save to successfully add a record in the section. The last section is the EFT enrollment overview. Virginia Medicaid allows one active EFT enrollment per NPI or tax ID, which includes all service locations associated with that identifier. EFT enrollment overview only applies to a typical group, facility, and individual enrollments. To add an EFT enrollment record, click Create New. A window appears where you can enter information. When finished, click Save to successfully add a record in the section. A confirmation message appears saying that the request for the EFT enrollment record has been successfully submitted for processing. After the request is approved, it will be added as a record. Only one active EFT enrollment can exist per base ID, which includes all the service locations under NPI or API listed on your provider identifier bar. If an existing currently active EFT enrollment already exists and you wish to change it, click on the existing EFT enrollment record. A window appears with the record details. Click Edit. Update the end date to the last date that you wish to process billing with that account, which must be greater than or equal to the current date. Then click Save. Your request to edit the EFT record must be processed before adding a new EFT enrollment record. After the request has been processed, add the new EFT enrollment to reflect your desired changes. When finished with the General Information module, click Next. Let's learn about the Specialties module. The Specialties page appears. The Specialties page contains information about your specialty, which is associated with your provider type, and your taxonomy, which is associated with your specialty. On this page, you can view, add, or update your specialties and taxonomies. The first section is listed as Service Location Information. The information presented in this section is view only and cannot be updated. Below Service Location Information is the Specialties section. Here you can view and/or update your specialties. However, one specialty must be a primary specialty. If you need to change your primary specialty, refer to the Virginia Provider Portal User Guide. To add a specialty, click Create New. The Add Specialty window appears. Type in the keywords or the specialty number for the specialty you wish to add, and click on the specialty from the drop-down list. Select a taxonomy from the drop-down list. Complete the effective and end dates. Select whether this specialty is your primary specialty. Then add any necessary attachments by clicking on Create New. There is not a specific attachment type required. Select the best match to document your license certification, etc. for your new specialty. When finished, click Save. A confirmation message appears, saying that the request for the new specialty is sent for processing. Once processing is complete and the request is approved, the specialty displays in the Specialty section. Repeat these steps if you need to add more specialties. If you need additional taxonomies not already associated with your specialties, you can add them in the Additional Taxonomy section. When finished with the Specialties module, click Next. Let's learn about the Addresses module. The Address page appears. The Addresses page contains information about the service location, pay to, mail to, remit to, and IRS addresses used to support provider services. The Addresses page does not display for providers only enrolled as an individual with a group. On this page, you can view, add, or update your address information. The first section is listed as Service Location Information, which contains the service location identifying information. Below the service location information is the Location Name and Addresses section, which contains the name of the service location along with the addresses associated with the service location. Lastly is the Office Hours section that contains the hours of operation for the service location. To change the information for an address in the Addresses section, click on the desired address you wish to update. A window appears displaying the address information. Click Edit. Then proceed to make your desired changes. When finished, click Save. The confirmation message appears saying that the changes were successfully saved. When finished with the Addresses module, click Next. Let's learn about the Service Location module. The Service Location page appears. The Service Location page contains affiliated provider service location information, such as whether new patients are accepted, age restrictions, etc. Proceed to make any updates if needed. Note that information for non-affiliate service locations is stored in the Addresses module. When finished with the Service Location module, click Next. Let's learn about the Organization module. The Organization page appears. The Organization page contains information such as the organization type, business start date, tax classification, etc. Proceed to make any updates if needed and click Save. When finished with the Organization module, click Next. Let's learn about the Affiliation module. The Affiliation page appears. The Affiliation page contains a list of all the affiliations between individuals within a group and group providers, and between ordering, referring, and prescribing providers and facility providers. Individuals within a group provider can search and view group providers and vice versa. Ordering, referring, and prescribing providers can search and view facility providers and vice versa. The Affiliation page does not display a typical providers or providers, only enrolled as individuals. The Authorized Administrator section is a list of individuals within the group provider who have selected the group to which the enrollment belongs as an authorized administrator. This section does not apply to facilities. Group and facility providers have a list of all associated providers. Additional providers may be affiliated by clicking Create New. Individuals within a group and ordering, referring, and prescribing providers have expandable rows in the Affiliation section. Click the caret icon to display the full service location details of the associated provider. Individuals within the group provider also have a section to assign an authorized administrator. Click on the magnifying glass icon to search for an authorized administrator. The Search Affiliated Provider window displays. Click the service location for the already affiliated group provider that you would like to assign as your authorized administrator. The provider name field populates. Click Save to assign the authorized administrator. To add a provider in the Affiliation section, click Create New. The Add Affiliate Provider window appears. You can enter the service location ID or NPI. Then click the magnifying glass to search for an affiliated provider. You can also click the magnifying glass icon without entering a service location or NPI to search for the provider by name. If you entered an NPI and the provider has more than one service location, click the Service Location ID hyperlink to select the provider and populate the information. Clicking on Other Details does not select the provider. Enter the effective date, then click Save. A confirmation message appears saying that the affiliated provider was successfully saved. Let's learn about the Credentials module. The Credentials page appears. The Credentials page displays information for license, Medicare number, Drug Enforcement Administration, or DEA number, Council for Affordable Quality Healthcare, or CAQH number, and NPI details of the provider. Note that you can switch between the tabs in the Credentials section to view more information related to the specific tab. Proceed to add or update information if needed. When finished with the Credentials module, click Next. Let's learn about the Provider Type module. The Provider Type page appears. The Provider Type page displays information such as the Clinical Laboratories Improvement Act, or CLI information, durable medical equipment, prosthetics, orthotics, and supplies, DMEPOS surety bond and accreditation information, and hospital bed information. Note that you can switch between the tabs in the Provider Type Information section to view more information related to the specific tab. Proceed to add or update information if needed. When finished with the Provider Type module, click Next. Let's learn about the Other Information module. The Other Information page appears. The Other Information page displays information such as certification details and language details. Note that you can switch between the tabs and the Other Information section to view more information related to the specific tab. Proceed to add or update information if needed. When finished with the Other Information module, click Next. Let's learn about the Disclosures module. The Disclosures page appears. The Disclosures page contains information related to managing employee associations, owner associations, and subcontractor associations. Proceed to update information if needed. Note that you can switch between the tabs in the disclosure section to view more information related to this specific tab. If you need to create another disclosed entity, click the correct tab and click Create New. When finished with the Disclosures module, click Next. Let's learn about the Managed Care Organization, or MCO Network module. The MCO Network page appears. The MCO Network page displays a list of the MCOs that the provider has contracted with. You may submit a request, including any required attachments, to contract with another MCO. To submit a request to an MCO, click Create New. The Add Managed Care Organizations window appears. The available MCOs list on the left includes those with whom the provider does not currently have a contract or pending application. The selected MCOs list on the right includes those whom the provider would like to contract with. Select an MCO or MCOs from the available list, then click the single right-facing arrow to move it to the selected MCOs list. You can click the double right-facing arrow to move all MCOs from the available MCOs list to the selected MCOs list. If you wish to remove an MCO from the selected MCOs list, click on the desired MCO or MCOs and use the single or double left-facing arrows to move them to the available MCOs list. When finished, click Next. If disclosures are required, they are displayed in the Disclosure Form section. Click Create Self-Disclosure to open the disclosure in a new window. Complete the disclosure and click Save at the bottom of the form. Repeat for any additional disclosures. Based on the provider type and specialties of the provider that is initiating a contract request, there will be different sets of required attachments listed in this table. The left column indicates which attachments are required. The right column indicates whether files have been uploaded to meet the requirements. Optionally, additional supporting documentation may be attached. To upload an attachment, click Create New. Complete the fields, upload your attachment, and then click Save. The attachment record has been added, and the requirement that the field for that attachment type has changed from No to Yes. Repeat the steps until all the requirements are met. In the MCO Consent section of the window, agree to the terms and conditions for each MCO that was selected in the previous window by selecting the I agree checkbox. The first name, last name, and consent date fields auto-populate. Click Submit. A confirmation message displays with a tracking number. Click OK. Your request is sent to the MCO or MCOs for review, and they will reach out to you regarding the next steps. MCO participation requests may require additional information before the MCO can make a decision. Follow these steps in the case that an MCO needs additional documentation to approve your participation request. A notification message will display on your provider portal homepage. Confirm that you read the notification message. Then go back to the MCO Network module. The MCO Contracts Attachments Required section is displayed at the bottom of the page. To upload the required documentation, click the Upload Files icon. The new attachment window appears. Click Select File, then click Upload Files. A confirmation message appears saying that the file has been successfully uploaded. Once the MCO approves the documentation, the MCO Contract Attachments Required section no longer appears, and the MCO is listed in the MCO Contract section with a Yes in the Participation Status column. When finished with the MCO Network module, click Next. Approved items are displayed on the module pages where the request was submitted. Let's learn about the Request Tracking module. Though some changes immediately save, many changes will require additional review and processing before they display in the provider portal. After you save a change request that requires processing and transaction ID displays, click the Request Tracking tab to view all in process, approved and rejected change requests submitted through the provider portal with the exception of MCO participation requests. While under review, items will display as in process and will update to approved once the request has been confirmed. Note that while items are in process, additional changes may not be requested for the same type of information. Approved items are displayed on the module pages where the request was submitted. Let's learn how to view your account profile information. To view your provider portal account profile information, click the Maintenance module, then select Portal Profile Maintenance. Then My Account Profile window appears with your profile information. In this window, you can view, verify, and if necessary, update your profile provider information. To update your information, click Edit. After you update your information, click Save. Note that if you are a registered delegate, a relationship code field appears on this page. To allow more providers to add you as a delegate, you must give the relationship code to those providers. Next, we are going to learn how to create new delegates and manage existing delegates. The Manage Delegates functionality allows providers to create and maintain delegates who can work in the provider portal on behalf of the primary user. A provider can have multiple delegates, such as administrative or clerical staff, to perform different functions. To access delegate functionality, click Maintenance, and then select Manage Delegates. If you have more than one service location, click the field for a drop-down list and select a specific service location to filter the list of delegates for that location. The delegates assigned to that location are displayed on the Register tab. To view a delegate or edit security functionality, double-click a delegate record. Note that the active checkbox in the Profile section can be deselected to remove all provider portal access for that delegate for your service locations. If the delegate only has access to select service locations, you can edit their access for specific locations from the active checkboxes in the Security Functions table. When finished updating the delegate, click Save. The process of adding a new delegate varies slightly depending on whether the person is already registered on the provider portal. Registered delegates already have provider portal credentials and unregistered delegates do not. To add a delegate who already has provider portal credentials, click Add Registered Delegate. The Add Registered Delegate window opens. Enter the delegate's last name and relationship code. The delegate can find their relationship code on their portal profile maintenance page. Click Continue. After the last name and relationship code are validated by the system, the Add Registered Delegate window displays. Select the appropriate level of security for the delegate. To assign the delegate to all service locations, select the first option. Select Delegate Administrator to also assign the delegate the ability to add and maintain other delegates on the provider's behalf. Delegate administrators have all available security functions assigned to them. To assign the delegate to all service locations with the same but limited access, select the second option. Move access that you want to assign to the delegate with the right arrow buttons from the left available functions to the right selected functions. You may have a third option available: to assign the delegate to specific service locations or modify the delegate's access across service locations. Select the third option. Check the active checkbox in the table for each service location that the delegate will have access to. Optionally, select the DA checkbox to allow delegate administrator rights for that location. Note that you must click each service location row and assign the desired access before saving. If the delegate does not have administrator rights for the service location, move the access that you want to assign to the delegate with the right arrow buttons from the left available functions to the right selected functions. After selecting security rights, click Submit. Next, let's add an unregistered delegate. An unregistered delegate does not currently have an account in the provider portal. Click Add Unregistered Delegate. The Add Unregistered Delegate window opens. Add contact information for the delegate and ensure all required fields are filled out. Just like with the registered delegate, select the appropriate security rights and click Submit. New delegates must complete registration the first time that a provider assigns them to manage functionality on their behalf. Once assigned, credentials are generated and sent via email to the delegate. The delegate must complete registration to access the provider portal. Let's review what you learned in this tutorial. You can understand the basic navigation of the provider portal. Identify which tasks are accessed from the provider portal but completed in other systems. Manage provider information and identify where to manage delegate information. Thank you for completing the Virginia Provider Portal Overview e-learning training.